and when you turn the lever, it should tighten. And so when it tightens, that should hold the position. As you can see, in both positions, it doesn't. Hey guys, how's it going? Today I want to take a little bit of time to walk through a pretty basic repair that I think might be relevant for both repair technicians and dental offices alike. We all know the scenario where when you are in your dental office and the patient needs to have their head positioned, which is critical for dental stuff. If the headrest isn't stable, what can happen is you don't have any way to kind of control their head, and that can be a problem. So today we're going to go ahead and we're going to look at a chair that I have. I was kind of putting it away, and it has a loose headrest. So in today's video, we're going to take apart a headrest. We're going to look at the concepts related to this particular headrest that are transferable to other types of headrest. And with this little bit of exploration, hopefully we learn something together about how dental chairs work and also how to fix them. Let's get to work. All right, guys. First thing we're going to do is we're going to go ahead and take a look at the dental chair itself. This is an A-dec 1015 dental chair, and as you can see here, I have the headrest right here, and the headrests on most dental chairs just pull straight out, and they are removable. So this particular headrest is has a mechanism on the back that has a lever, and when you turn the lever, it should tighten. And so when it tightens, that should hold the position. As you can see, in both positions, it doesn't quite, it doesn't do its job. And so what we're going to do is we're going to go ahead and explore this headrest and how to fix it. This is the initial issue that we have here, and so we'll go ahead and cover the how to take it apart, how to tighten it, and then how to test it. So let's get going. So as we dive into our dental headrest, we're going to go ahead and cover a couple terms up front. The first thing we're going to talk about is the key components of the dental headrest. The first thing we're going to talk about is the actual main post. This chair post is what actually interfaces with the dental chair, and these posts are specifically designed for certain types of chairs. So if you ever have a missing headrest or you need to get a replacement headrest, it's very important that the first thing that you do is make sure that the base of the headrest itself, the post, interfaces with the chair. The second thing we're going to talk about is the actual lever itself. Now the lever is the part that you would grab onto. Sometimes it's a push button. There's many different ways to control headrests, and it's just important that you understand mechanically what is the part of the headrest that should cause it to be immobilized. The next thing that we're going to go ahead and cover is the types of hardware that are utilized in dental headrests. Now there's, I would say, probably 4 different types of hardware that you would find. The first is going to be something called a Phillips screw, which is basically that little cross-tipped looking screw. The second type might be a Allen wrench, or Allen key. That particular Allen screw is going to have a hexagon shape to it, and that's going to be what that is. Now with those, there's either metric or standard. You'll need to determine with your own dental chair what types of screws you have on there. The third is going to be possibly Torx, T-O-R-X. That looks like an Allen key, but it is really a it has like more of a star pattern. And then the last one is going to be probably like a standard screwdriver, slotted screwdriver. So for this particular one, we have Phillips screws. So the first thing we're going to do is I'll get you a little closer here, and then we'll begin exploring the headrest. And I will walk you through how I would evaluate and repair this headrest. All right, so the first thing we're going to do is we're going to go ahead and look a little bit closer at this headrest. Now, here on the on this side, we'll see that there are 2 openings for screws. Now, these 2 screws are right here and right here. Now, the purpose of those screws is to hold on a side cover plate, and there's also screws here and here. So first thing we'll do is I will go ahead and remove the screws that I can, because the friction, okay, is generated in the center here of this mechanism. So by removing these screws, we're going to go ahead and reveal what is happening inside of there, and that will give us our next step. So here we go. I'm going to go ahead and pull these screws off. Okay, there's going to be, and now actually that one there, I don't really need to take it all the way out because I can see enough what's happening. So I'm going to go ahead and set these 2 screws here and this one here. So let's go and take a little bit closer look at this mechanism. Now what we have here is basically a mechanism by which when this lever turns, it applies pressure to these 2 bars that are right here, okay? And those bars, when this lever is tightened, those 2 bars are tightened, and that causes there to be tension on these 2 bars that locks the headrest in place. What I can also see is that on the back side here, I can see that there is a slotted, basically it's almost like a nut, except it's not a nut. And then I can also see on this side that there is an Allen key that's in the middle. And so mechanically what's happening is that Allen key in the middle right here is called a set screw. The purpose of the set screw is to hold this other screw in position. So when we loosen this set screw with an Allen wrench, which might be the original, which might be the problem of it, so that Allen key fits right inside there, and then we go ahead and we loosen it. Now that was already super loose. And so what's going to happen is this handle here, actually as it turns, it spins inside of here. So it actually spins this screw that's in here. So what we're going to do is by spinning this, we're going to actually be able to tighten that in there. And then what's going to happen is as we move this, that pressure will be able to be applied to these threads as where they're locked still. So by moving this part, we're going to actually push that in further, which is going to, or maybe even pull it out further, I guess. So that's going to create more tension. I'm going to go ahead and do it, and then that should help things make a little bit more sense, because I'm just trying to explain right now, use my words. So the tool that I need is a large screwdriver. So see how there's that big, this guy right here? I need a screwdriver for that. So I'm going to go get the big honking screwdriver. All right, got the big honking screwdriver here, big gigantor. All right, so what we're going to do is we are going to go ahead and we're going to tighten this. And when we tighten it, okay, it's going to spin around in circles. All right, so we're going to tighten that, and then we're going to try to just get it to a position where this knob starts to kind of work. So I'm going to tighten this in a tightening manner. All right, actually I'm going to back this off to kind of like make it as loose as possible. I'm going to tighten that. And we're tighten that. Okay, and then that is pretty tight. So the next thing I'm going to do is I'm going to go ahead and use my Allen wrench, and I'm going to tighten this set screw, and we'll see kind of where we're at position wise. Now this might take a couple times to get it right, but basically what's happening here is the set screw, as that goes in, it's actually making contact with this other insert here. And so by tightening that, we're going to allow for these threads that this handle is interfacing with to remain still. So now we're going to go ahead and we'll see what happens. Okay, that feels already much tighter as it is. As I move it, I can already feel that has a lot more. That feels better. Now I'm going to go ahead and push this up. Oh yeah. Okay, so that's nice and tight. Now I'm going to try to move it, and guys, I can't. Oh, I can barely move it. Oh, I have to like work really hard on that to like even get it to move a little bit. So I'm going to say that actually was a good adjustment. So we're going to test it by pulling that. Everything moves, easy, set a position, and then we're going to tighten that, and then boom. Okay, that is nice and good there. So we're going to reveal everything. We'll make sure that our set screw is nice and tight. Okay, and then we're going to put all of our little covers back in place. Okay. All right. All right, and then we'll go ahead and test it with all the covers back on. So there we are. We'll go like that, and now that's tight as can be. That's fixed. Okay. All done. All right, guys, and just like that, our dental headrest is repaired. We have, again, a full, it moves, and then it doesn't move. That's what we want. So we're going to go ahead and put that right back here inside the chair. Okay, and now we will go ahead and we'll test it in the chair. Everything is good. Okay, and that is what we want. So, dental headrest, now sometimes you can't fix them depending on what's the matter with them. If you have a problem where your dental headrests are not repairable, or even sometimes if you have a dental headrest that's missing, that's happened sometimes, I would suggest that you find a business that handles used dental equipment like mine or somebody else's, or maybe even eBay, and just go ahead and try Googling the particular chair model and headrest. And what you'll find is that you might have a headrest that's broken beyond repair, but it might be possible for you to go ahead and get another headrest on the used market. Again, pay attention to the measurements, and hopefully that will help you to get that dental chair back in operation. So thanks for spending a little bit of time with me here, learning about some dental chairs. On the side note, I have some really exciting news coming up. We are launching a dental CE course for doctors. And the very first course we're doing is how to basically dental air compressor 101. So 101, I should say. I'm very excited about this, and it has been a long time coming. And now we're just trying to figure out how to help the market in new and exciting ways. But for today, I'm glad we were able to give you a little bit of information about your dental chairs and your headrests, and I hope this information serves you well. If there's anything else that you'd like to learn about, any other basic repairs around your office, please let me know. Fire off a comment down below. Let me know you're out there, and I'll be more than happy to try to generate some content based on what you'd like to see. You guys have a fantastic day, and thanks for tuning in.